The first step towards implementing good sleep practices is to ensure a safe sleep environment for your child. The increase in the number of cases of SIDS or sudden infant death syndrome led to an increase in the awareness on a safe sleep environment. United States and other countries in the West were instrumental for creating this awareness. As explained previously, SIDS is the sudden unexplained death of a child which occurs usually during sleep. Apart from SIDS, a high number of crib-related injuries were also observed which required hospital treatment in some cases. In modern times, usage of products related to a child's sleep environment such as cribs, rockers or cradles has drastically increased in India. In addition to these products, parents buy a lot of other things for their child's bedroom and sleeping space. Therefore, it is imperative that parents should be aware of the current guidelines on how to create a healthy and safe sleep environment. In this video, I will cover different topics related to safe sleep environment. Additionally, I will cover crib safety in detail in the subsequent video. Some of the common questions frequently asked by parents are: where should the child sleep? Should the child sleep in the same room as the parents or in a different room? Should the child sleep in the parents' bed or separately in a crib? Which is the safest approach? I'm sure that you can relate to some of these questions, if not all. In the Western countries, a lot of parents prefer to make their child sleep in a separate room directly from the early days. At times, the separate room is set up even before the child is born. It is completely fine if you want to follow this approach as long as you prepare the child's room as per the guidelines that I will talk about. On the contrary, in India, very few parents are comfortable with this approach. Most mothers get anxious with their child sleeping in a separate room. Hence, I would recommend to make the child sleep in the same room as the parents, but in his or her own crib. I strongly suggest that the child should have a separate sleeping space and should not co-sleep with the parents on their bed. As the child grows older, the crib can be replaced with a mattress on the floor of the bedroom beside the parents' bed. With the child sleeping in the same room as the parents, it is easier for parents to supervise and check on their child. Additionally, it's easier for you to feed your child if you're still breastfeeding at night. However, ensure that you don't allow your child to fall asleep on your bed while you're feeding. After feeding, the child should always be put back to sleep in a separate sleep area such as a safety-approved crib, bassinet or a mattress. According to the latest Safe Sleep Environment Guidelines, separating the child's sleep space from the parent's sleep space greatly reduces the risk of SIDS and other sleep-related injuries. It is also recommended that the child should not sleep in an adult's bed or on a couch or in a chair, neither alone nor with anyone else, until the child is about 2.5 years old. So what precautions should be followed for maintaining a safe sleep environment in the child's room or sleep area? The temperatures of the room should be similar to what an adult would find comfortable. It should neither be too cold nor too hot. The child should remain sufficiently warm. The child's bedroom or sleep area should strictly be a non-smoking zone. Ensure that your child is not exposed to any form of passive smoking. While placing the crib in the room, choose a spot which is not too close to a window. Try to keep the crib at a far distance from the window. If this is not possible due to space constraints, then ensure that the temperature of the room is maintained and no hotspots are created around the crib. However, never place the crib near a window with blinds or curtain rods. It is not safe to have loose cords around the sleeping area as the child might get strangled with it. The child's sleep position is as important as the child's room or sleep area. Always place your child on his or her back when put to sleep at all sleep times, that is both daytime naps and overnight sleep. Studies have shown that sleeping on the back is the safest position for children, as the occurrence of SIDS is found to be less. This raises an obvious question in a parent's mind. What about tummy time, and is it recommended? Yes, you should give your child plenty of tummy time, but only when he or she is awake and is under supervision. Supervised tummy time helps the child's neck, shoulder and arm muscles become more stronger. It also helps to prevent flat spots on the back of your child's head. However, remember that it should always be done under supervision. To conclude, follow practices that create a safe sleep environment for your child. A child should never co-sleep on the parent's bed. Ensure that your child sleeps independently in a crib, either in the same room or a separate room. Maintain a comfortable temperature in the room. It should neither be too cold nor too hot. Keep the crib as far as possible from the windows. If this is not possible, then ensure that there are no blinds or curtain rods near the crib. A child's room or sleep area should be a completely non-smoking zone. The child should always sleep on his or her back and give tummy time only under supervision. Remember, the ABC of safe sleep is that the child should sleep alone on his or her back in his or her crib.